Here, especially in Dallas County, there's always been health care available for you if you want it. In the past, about the only place you could go to was Parkland. Parkland had something set up for those that could not afford it, but then usually getting there was a problem. Transportation wasn't as easy as it is. Even today, for some folks, it's still pretty rough. So I guess that going along on that journey of trying to get health care, sometimes it's difficult. And then we, as a people of color, are sometimes a little skeptical of the doctors because we hear so much about what they're doing and how they treat us as patients. Well, in fact, how they treat us as human beings. I've had, and my family had, because of the work I was in, I always had pretty good insurance. Expensive, but if you want to take care of your health, you pay the price that you need to pay to make sure you got good health care. So I would make sure I got my physicals every year, and any other problems that pop up, I made sure I saw my physician. And I also did the same thing for my children and for my wife. And I tell this all the time, I've been married for 53 years. So the family, we made sure we take care of them. The kids had their shots, and we made sure that all the other health care was, I didn't want them to be like me. As I was growing up as a kid, we didn't have access to the health care that's available now. So I wanted to make sure that they had that health care. I mean, man, I think I was 13 years old before I saw my first doctor, and I cut my finger really bad, and I didn't have any other choice. I had to get it sewed back on. But other than that, we never saw the doctor. Grandmother always had a cure for us, or Mama had a cure for us that we didn't need to see the doctor.
Good morning, Mr. Allen. How's it going?
I'm fine, and you?
I'm doing great, but I want to find out how your feet are doing. Now, we went through a list of things that you were supposed to be doing and following up on with the treatment plan. Have you been following the instructions with using the medications and things?
Yes and no.
Yes and no?
Yes and no.
Explain.
Well, some of it gets a little tedious, then I remember Dr. Bauer said, do this, or you'll have this, do this, or we might have to amputate. So